In this skeletal model, you can see that the first rib is above the shoulder blade. It's near that very thick part of the trap, you know, where Spock would squeeze that muscle. It's right below that thick part. And it attaches to the first thoracic vertebrae right below the neck. Okay, so that's the tubercle of the first rib. And it's a bump, it's a distinct bump. Okay, so when the patient is lying on their back, I'm the cameraman, my wife is at an appointment, so I don't have a videographer. So you can pinch that thick muscle, and then you can put your middle finger right below that thickest part of that muscle, and you'll feel that dent of that bump of the first rib. Notice the first rib is a short C. It's C-shaped, very different shape than the other ribs. And it attaches to below the clavicle. So you can move the first rib by moving the clavicle. Okay? And this is a technique of releasing the first rib in the transverse plane. A lot of clinicians are taught to push the rib down towards the feet on the basis of tight scaling muscles. But I find a lot of restriction in the transverse plane, which is this way, medial lateral, left to right, okay? And what was interesting was that when I first captured the back of her first rib and I lifted it up, she had mobility. But when I pushed on it for a little while, took it to an end range, and then I did a spring test, then I did an extra little thrust, then it was stuck. So my initial testing told me that it moved, but then when I, continued to push it up to an end point, and then I thrusted it, then I found that it did not move. Whereas when I tested the other side, her left rib I could move up to an end point of movement, and then thrust it, and it moved. So the release that I've developed is to come under the thickest part of that muscle. So you pinch that trap muscle, and I can feel my index finger. Okay? So I can feel through the muscle. So then I take my middle finger and I go below it and I feel for a bump, and that's the first rib. And I bend my fingers like this, and so my index, middle, and ring finger will certainly capture that first rib. And I just gently lift it up, and it's about 1.5 inches out from the middle of the neck, okay? So my treatment is to lift that up on this peg, okay, and I hold that for 30 seconds. And then I want to pull the front of that through the clavicle, so then I walk up the armpit. So her arm is on her side, and I just walk up this axillary crease, and then I fall down on this bump, which is called the acromion, okay? So the technique is like this. I pinch the trap, and then I put my index finger below, and I feel for a bump. Boom, there it is. And so I'm lifting up with 2 or 3 fingers, and I hold that for 30 seconds, and then I come up here, capture the acromion, and push it backwards towards the floor. And I maintain that for 2 minutes. I want Amy to tell us how she responded to me treating her first rib, which is now moving normally.
It felt powerful when I was up and moving around. Like, I can definitely tell, like, I was having a whole body reaction when I walked around. But when I was laying on the table and you did it, I could feel my whole right, I guess my hip flexor, my thigh, my abdomen, and even my glute kind of like jerked open just on its own and released. And these 2 spots have been what I feel like have been hitched up or holding me in a place that's uncomfortable. So I definitely felt it just let go.
Interesting. Very interesting response. And I've had that in other clients. I've had them have a release in the pelvic region in response to moving that first rib.
Yeah, and it was totally involuntary. I mean, it sort of surprised me.
Nice. Well, not many clinicians know about this transverse plane release of the first rib. And I submit that it gets stuck at end range. I don't believe in the subluxation theory. It doesn't get out of place. It's simply that with a twisting injury to your neck or upper back, it moves to a normal physiological end range, but it stays there. Okay. Instead of coming back to its neutral. So thank you for letting me film and post this.
Okay.